Pharmapal.
The effects of Anastatica hierochuntica on prenatal skeletal health. Welcome back to our channel. Today, we're diving deep into the fascinating world of skeletal development, as observed in a recent study on Sprague-Dawley rats. We also discuss the skeletal staining techniques used in prenatal development studies. We'll explore how these methods help us understand the effects of various substances on fetal skeletal development, particularly focusing on the modified double staining technique or double skeletal staining procedure. This technique is crucial for studying the skeletal systems of full-term fetuses, especially in research settings. Have you ever wondered how researchers study the effects of drugs or herbal extracts on fetal development? In our study, we aimed to investigate the potential teratogenic effects of the plant Anastatica hierochuntica on the skeletal system of Sprague-Dawley rats. We can visualize skeletal structures and assess any abnormalities by employing a modified staining technique. This is crucial for understanding how certain substances might impact growth and development. Overview of skeletal examination. In this study, researchers examined the ossification of various bones in both the forelimb and hind limb of the rats. This included key bones like the humerus, radius, ulna, and pelvis bones. They looked for any abnormalities or malformations that could indicate developmental issues. Methodology: modified staining technique. The researchers employed a modified double staining technique to visualize skeletal structures. This method allowed for clear differentiation between bones and cartilages. Here's a quick rundown of the process. 1. Fixation in 10% buffered formalin. 2. Skinning and dehydration using ethanol. 3. Staining with Alcyon blue and alizarin red S. 4. Clearing to enhance visibility of skeletal structures. Now, let's break down the process step by step, making them easy to understand and remember. 1. Fixation of full-term fetuses. First up, we start with the fixation of our specimens. The fetuses are euthanized and then immersed in 10% buffered formalin for 24 hours. This step is essential to preserve the tissues. After that, they're transferred to 70% ethanol until we're ready to stain them. 2. Skinning and evisceration. Next, we move on to skinning. Using microdissecting scissors, we create vertical and horizontal slits in the skin. This allows us to gently pull the skin away from the body. It's a delicate process, but it's crucial for ensuring that the staining agents can penetrate the tissues effectively. Dehydration. Once the skin is removed, we begin the dehydration process. The fetuses are placed in 95% ethanol for about 24 hours, followed by absolute ethanol for another 24 hours. This step prepares the specimens for staining by removing water from the tissues. Alcyon blue staining. Now, let's talk about staining. We use Alcyon blue 8GX at a concentration of 0.01%. The specimens are immersed in this solution for 12 to 24 hours. Alcyon blue specifically stains cartilage, giving it a beautiful blue hue. Rehydration. After staining, we need to rehydrate the specimens. This involves immersing them in a series of ethanol solutions, starting with 95% ethanol for 1 to 2 days, then 70% ethanol, and finally, distilled water for another 1 to 2 days. Alizarin red S staining. Next up is the alizarin red S staining, which highlights the bony structures. We prepare a 0.002% solution and immerse the specimens for 12 to 24 hours. This stain reacts with calcium deposits, turning them a striking red. Clearing process. Now, we enter the clearing phase. We start with 2% KOH for 12 to 24 hours, followed by a mixture of 2% KOH and 85% glycerin for 3 to 5 days. This step is crucial for making the skeletons visible while ensuring that we don't damage the delicate structures. Preservation. Finally, to preserve our beautifully stained specimens, we immerse them in glycerin with a touch of thymol to prevent fungal growth. This ensures that our specimens remain intact for future examination. Skeletal examination. Once preserved, the skeletons are examined using specialized software and equipment. This allows researchers to assess the skeletal structures in detail, comparing treated fetuses with controls. And there you have it. The double skeletal staining procedure is a meticulous yet rewarding process that provides invaluable insights into skeletal development, and here is to sum up the process. 1. Fixation. We began by fixing the euthanized fetuses in 10% buffered formalin for 24 hours, followed by immersion in 70% ethanol until staining commenced. 2. Evisceration. Next, we carefully skinned and eviscerated the specimens to prepare them for dehydration. 3. Dehydration. The fetuses were then immersed in ascending concentrations of ethanol, starting with 95% ethanol for about 24 hours, followed by absolute ethanol for the same duration. 4. Staining. For staining, we prepared a 0.01% Alcyon blue solution and immersed the specimens for 12 to 24 hours. After that, we rehydrated them in a descending series of ethanol concentrations before applying alizarin red S to stain the bones. Now, let's take a closer look at the results. After completing our staining process, we observed some exciting results. The modified staining method allowed for clear visualization of both cartilage and bone structures. Notably, we found multiple skeletal anomalies in fetuses from dams treated with higher doses of Anastatica hierochuntica. In contrast, control group fetuses exhibited normal skeletal development, highlighting the potential impact of the extract on fetal growth. Table 2 summarizes the occurrence of skeletal abnormalities across different groups of rats treated with varying doses of AHAE, an aqueous extract. Here's what we found. Control group, no anomalies observed. 250 mg per kilogram AHAE, some abnormalities noted, particularly in the thoracic vertebrae. 500 mg per kilogram AHAE, increased frequency of malformations. 1000 mg per kilogram AHAE, highest incidence of skeletal anomalies. Figure 3 shows normal versus abnormal skeletal structures. It presents a comparison of normal and malformed skeletons. The ventral and dorsal views clearly illustrate the differences. The control group displays a typical skeletal structure, while the treated groups show distinct deformities in the sternum and ribs. 5. Statistical analysis. Understanding the data. Statistical analysis was crucial in this study. The researchers presented their findings as a percentage of occurrence. They noted that no specific quantitative methods were applied due to variability in skeletal anomalies. Instead, they focused on the significance of the observed anomalies based on literature reviews. What are the key antenatal factors identified in the study contribute to the development of orofacial clefts? The study identifies several antenatal factors that may influence the occurrence of orofacial clefts, including maternal nutrition, deficiencies in folic acid and other essential nutrients during pregnancy, environmental exposures, use of certain medications, such as anticonvulsants, and exposure to teratogens, genetic predisposition, family history of clefts, indicating a potential genetic component. Maternal health conditions, diabetes and obesity have been associated with increased risk. Discussion. So, what do these results mean? Our findings suggest that the modified double staining technique effectively assesses skeletal development and identifies anomalies. The clear distinction between cartilage and bone structures allows researchers to evaluate the effects of various treatments on fetal development accurately. However, it's essential to note that while some abnormalities were observed, further studies are required to determine the clinical significance of these findings. Understanding the implications of herbal extracts on fetal development can guide safer practices in both medicine and agriculture. How does the study's methodology strengthen the validity of its findings? The study employs a robust methodology, including sample size. A significant number of participants were included, enhancing the reliability of the results. Control groups. Comparison between affected and unaffected groups helps isolate the impact of specific factors. Statistical analysis. Appropriate statistical methods were used to analyze the data, ensuring that the results are statistically significant and not due to chance. What implications do the findings have for public health initiatives aimed at reducing the incidence of orofacial clefts? The findings suggest several public health implications. Nutritional programs, emphasizing the importance of prenatal vitamins, particularly folic acid, to expectant mothers. Education on teratogenic risks, informing pregnant women about the risks associated with certain medications and environmental exposures. Screening and counseling, offering genetic counseling for families with a history of orofacial clefts to assess risk and provide guidance. What limitations did the authors acknowledge, and how might these affect the interpretation of the results? The authors acknowledge several limitations, including retrospective design. The reliance on maternal recall for certain exposures may introduce bias. Geographic focus. The study's findings may not be generalizable to populations outside southern Nigeria. Confounding factors. Other unmeasured variables might influence the outcomes, potentially skewing the results. Based on the findings, what future research directions do you suggest? Future research could focus on longitudinal studies, to track the effects of identified antenatal factors over time. Intervention studies, evaluating the effectiveness of nutritional supplementation and education programs in reducing cleft incidence. Genetic studies, investigating the specific genetic markers associated with orofacial clefts to better understand the hereditary aspects. In conclusion, this study sheds light on the potential teratogenic effects of HAE on skeletal development. The findings underscore the importance of careful examination of skeletal structures in developmental toxicity studies. As we continue to explore the implications of these results, we hope to contribute to safer practices in both medicine and research. This study demonstrates the effectiveness of the modified staining technique and emphasizes the need for careful evaluation of substances that may affect prenatal development. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more exciting science content. Thanks for watching.
Pharmapal.